Well, thank you very much. Appreciate the chance to meet with you today. I think this is an incredibly important conference because it's the intersection of a whole bunch of different ideas that really matter a lot in dealing with mental health, dealing with law enforcement reform. How do we make all of that work? I think it's pretty fair to say that we have a number of crises in the country right now. Number one, a very strong mental health crisis. We have seen spikes in all manner of different mental health challenges that people have, from anxiety to depression to bipolar to things more severe than that. Certainly a lot of that grew out of the pandemic, but it was growing before the pandemic. And the second thing that has become apparent is the law enforcement community too often gets involved in trying to deal with what are basically mental health issues, and they're not trained to do that. So it's an intersection of all of these issues, all focused around one thing. And that is, two things. One, how do we get help to the people who need the help, who are facing these mental health challenges? And then how do we adequately protect the community? So a whole bunch of different ideas for that. But one of the most important is the idea of having social workers or mental health specialists who are able to help people who are experiencing mental health crises. Because in much of the country, we really don't have that. If someone has a mental health problem, whether it's in a home or on the streets, you call 911, and typically you get either law enforcement or the fire department. And as I said, neither of those are particularly trained to deal with those challenges. Now, something that has started happening is communities are training social workers and mental health specialists to respond to those calls. I guess the gold standard for these programs is out of Eugene, Oregon. The Cahoots program. And the Cahoots program, I'm going to be off a little bit here, but it's been going on, I think, for a little over 50 years at this point, where they have trained people to respond to mental health issues. And when a call comes in, that is the initial thing. Who goes? Who responds? And what is the situation? Is it a situation that requires either the fire department or law enforcement, or is it more of a mental health issue? Or in some cases, it can be both. In some cases, the mental health specialists that they have respond to that with law enforcement support. Other times they respond on their own. But shockingly, that program does not exist in a lot of communities. And my firsthand experience on this is dealing with the city of Seattle. The city of Seattle has a similar program. It's called Health One, and it's connected with the fire department, where they have trained primarily social workers, people who are trained to work with individuals in crisis, to go out to those communities. But the city of Seattle is a reasonably large city, 750,000 people, and they have exactly 3 social workers to go out and respond to those calls. And it's a brand new pilot program that's being set up. So, it is not anywhere near enough to meet the need. So I think there's a real chance here to deal with both police reform and with the mental health challenge that we face in this country. Because the other piece of this that we've seen tragically is a lot of times when law enforcement is called to respond to a mental health situation, they don't know how to deal with it. And people wind up being injured or in some cases killed because of that lack of training and lack of ability to deal with it. So ideally, what we need to do here is set up a program so that you can have people ready to respond. Now, some steps have been made in this regard. There are, federal funds available for some of these programs. Different cities are trying to set up these national programs. And of course, we now have the nationwide 988 number that people can call to seek help and have folks sent out. But a lot more needs to be done if we're going to be able to get adequate access to mental health. And also, police reform is part of this as well. Making our community safer by having the right people respond to the right situation. Locally, I was able to get some federal funds through a congressional earmark. I know we're not supposed to call them earmarks anymore. They're supposed to be congressionally directed spending. But whatever it is, it's an ability to actually help our communities in direct dollars. Got some dollars for the Health One program. I should also mention that outside of the city of Seattle and South King County, I forget, it's 4 or 5 suburban cities have coalesced together to also provide social workers and mental health professionals to help with the fire department's response. But again, it scratches the surface of what the need is, to be able to meet the problems that people have in our community in a responsive way. We need to greatly expand those services in order to make our community safe and get people the help that they need. It's something I'm very interested in working on. I've co-sponsored a bill to try to drive more dollars out there with Congresswoman Cori Bush and a number of others. We really need more focus on this issue to help to adequately deal with the mental health problems we face, and also to deal with police reform issues surrounding that. So it's basically what I'm working on, and I look forward to the conversation because I too have barely scratched the surface of exactly how we need to address these issues. So the expertise that your conference has here can be enormously helpful in helping policymakers like me figure out how can we get to where we should be in terms of providing these services to our community.
Well, welcome. Thank you, Congressman Smith, for telling us about your work in DC and in Seattle to build alternative responses to people in distress. We have some questions from the audience, and we have some questions. I have a couple questions. Could you just unpack for a moment a little bit more about Health One in Seattle? What has been going on there, and maybe specifically, how is it that the fire department was chosen to be a partner in Health One and not the police?
Yeah. Well, as the calls come in and they get rooted out, the fire department picks them up and they determine what the situation is. A lot of times when a call comes in, it can turn out to be a healthcare concern that, an EMT responds to from the fire department. And so they embedded them with the fire department. Now they work in close cooperation with the police. I mean, look, one piece of this is the very first thing that happens when a situation like this comes about is people typically call 911. And what a lot of people don't know about 911 operators, the most important aspect of their job is sifting through what they're dealing with. Okay. So the call comes in, you don't automatically know that it's a police call or a fire department call or not an emergency at all. It doesn't require any response. So 911 operators are trained to, 911, what is your emergency? And they work through those details. Now, I will say, and I was not involved in the development of 988, I question a little bit the need for the 988 number. What we really needed was people to respond who are mental health professionals when that was the 911 need. Okay, whether you can call 911 and still get to that point. But either way, you call a number and you get that response. The fire department seemed like a logical place to embed them. And they get all the calls and all the stuff comes in and they sort through it. The other thing that Health One does is they will sometimes follow up. So let's say there was a distress call, someone's suicidal somewhere, and the fire department responded and took care of the situation. And I went on one of these calls with Health One to someone who was in distress, and they did basically a welfare check where they went out with the healthcare professional to check on the individual in question and see how they were doing. So that's the reason that it goes through there. Now, throughout this whole process, law enforcement is potentially involved as well. And if there's a safety concern, law enforcement can respond. Now, there's a huge challenge here in terms of training. It doesn't always work that seamlessly between law enforcement and the mental health professional. Law enforcement is trained to deal with the situation one way. Mental health professionals are trained to deal with the situation the other way. They don't always agree. And so an integrated training system between the fire department, law enforcement, and the mental health professionals is crucial. But right now, as I've alluded to, one of the biggest problems is that we just don't have a lot of these people who are trained and available to go out and respond to these calls. So, but that's how the whole thing is integrated. And it tends to be more embedded with the fire department because it's put into that sort of healthcare response instead of criminal justice response. The law enforcement folks are supposed to be there. So, it's a matter of figuring out who is the appropriate person to respond, and crucially, how do they work together? How do they work together to understand what role each has to play and how to balance that?
Well, it's fascinating to me that fire departments have had traditionally done this, the follow-up call, where they go and meet with someone who, say, calling 911 a lot or little fires and have a conversation with them without the fire truck. And it seems like we've sort of taken the opportunity to step into that and have the fire department expand that tradition.
Yeah, no, it's really, it's a very difficult situation. When you're dealing with somebody in distress, you want to help them and you also want to protect the community. And that's part of the tension between mental health and law enforcement. I mean, law enforcement wants to eliminate the threat. Sorry, that came out wrong. By eliminate the threat, I don't mean necessarily, but basically make sure the person is not a threat. And if they have to restrain them, if they have to, handcuff them, whatever, make sure the person isn't a threat. But a lot of times that just ramps it up and makes the person more of a threat, particularly if they're in a mental health situation. So, knowing how to deal with that is a very complicated thing. So
it seems like having the right people on the team and associated with the team is key here. How, and we're of course in a terrible workforce, the trouble with the mental health community and the addiction treatment industry. What are your thoughts about expanding the workforce for mobile crisis?
Well, now that is a major, major challenge. In fact, you got to start with the fact that given our economy right now, every single group that I talk to, whether you're talking about, social service agencies, whatever the employer is, their first statement is, we can't find enough workers. Okay. It is a very difficult economy for that. And particularly when it comes to social workers, it typically doesn't pay that well. The reimbursement rates through Medicare and Medicaid, even if you get reimbursed, aren't that great. And there's not that many dollars dedicated to it. So it is hard to get a sufficient number of workers. Even if we were to say tomorrow, okay, we've looked at it and I don't know, I'll pick a random number out of my head. We need 100,000 social workers, nationwide in order to adequately respond to this. Well, you don't have that number to get there. So I think part of it is working with community and technical colleges, working with four-year institutions. How do we increase the pipeline of people getting that training? And part of it is increasing the pay and the compensation for them, which gets me into a very long, complicated, conversation about our healthcare system and what we pay for and what we shouldn't pay for. And one big message that I do want to deliver in all of this is typically in dealing with this situation, everyone's got 1,000 different places where we need to spend more money. That's basically my job. All week long, people come in and tell me about some area that we are not spending enough money on. Well, as you well know, we are running a $1.3 trillion deficit in this country. We have a $32 trillion debt. Hard to keep up. It's right around in that neighborhood. So yeah, we can run a debt, but we're not, the answer can't be we need another $1 trillion. All right. So how are we spending the money that we're currently spending and how could we spend it better? Now, I know part of this is, well, gosh, we're spending all this money on law enforcement. Couldn't we redirect some of those dollars? To some extent, if you got to the point where law enforcement wasn't responding to mental health calls, all right, then theoretically that would free up. We wouldn't need as many police officers to do that. Since they're no longer doing that, we'd have the mental health people do it. I don't buy into the notion that somehow we don't need police. There's an incredibly important role to be played there. And we've seen the challenges of too quickly reducing our criminal justice system in different ways. So it's always going to be a challenge to find those dollars. What I would say is look at our healthcare dollars. We spend more money per capita than any other country in the world on healthcare. It's not even close. It's almost twice as much as the next closest country. And we're not really getting great results. Okay. So where are we spending that money? And how can we, potentially spend it better? So that's part of it. You got to get the money. You got to train folks. I think the final thing I would say on this is how to put this exactly. I went through a significant mental health challenge myself. I had a chronic anxiety problem, saw psychiatrists and psychologists, took a whole bunch of different medications over the course of, 6 years or so. And I don't know that you need that high a level of education I think we need a base level understanding of what is mental health. How do you do triage? I think you can get there with something other than 8 years of education. I think we need to come up with the best practices and say, what is the level of training that you need to be able to deal with this so that we can train them more quickly in a more cost-effective way to get better results. But you've identified one of the biggest problems in dealing with this. So because it's hard to find the workforce, and if you find them, it's hard to pay them.
Well, that's great information and provocative to think about. And thank you for telling me a little bit of your story. I'm also a person with lived experience of mental illness and addiction. I'm glad to know you've got some experience in this to motivate you to think about this hard. Could you speak for a moment about the role of people with lived experience in alternative response, people with who are peer workers?
Yeah, I mean, sorry, I hate to put it this way, but lived experience is great if you learn something from it. Okay. And I'll tell you, we're suffering a little bit in the city of Seattle, in my area, of, the sole qualification for something is if lived experience. So basically, you've been in a situation where you had an addiction problem, or you were homeless, or you were incarcerated, all of a sudden you're more highly qualified to deal with the problem than if you haven't. That is very much not true. Okay. I think it's really important to get those perspectives always, regardless of where those perspectives are, what they are. Okay. Just to have a better understanding of it. But to necessarily simply place those people in charge of the decision-making process because of that lived experience, I think is a mistake. All right. What I want to know is, okay, you had an experience dealing with a mental health problem. You had an experience dealing with drug abuse. You had an experience dealing with homelessness. Tell me what you've learned and tell me how you would apply that. If it's just, okay, let me tell you my story. Well, that's great. And I want to help you. I want to figure out how to work with you, but I'm not putting you in charge of public policy unless you've thought that through and actually have an answer that's going to work. All right. Major problem in the city of Seattle with the King County Regional Homeless Authority that did that. They put people with lived experience in charge, and they burned through a whole bunch of money and produced absolutely nothing and wound up just shouting at each other at most of the board meetings. So lived experience is great. You got to apply it, and you got to actually have answers and results about what you've learned and how you're going to take that experience and turn it into actually helping people and getting results. So you got to have both.
I agree. Just hiring people as peers for the sake of their lived experience is pure tokenism and would amount to disaster. That's not a good plan. Let me ask you a couple questions from the audience, and ask you a question from Elizabeth in Iowa City. And she asks about what is the general awareness amongst your colleagues in Congress about the importance of mobile crisis teams? What's the temperature in Congress around this issue?
Well, unfortunately, how to put this exactly? There's an awareness of it, okay? But it's sort of lost in the broader political debate. And this is what we're dealing with here as well, is you have this intense debate about, about law enforcement, how it's supposed to be used, how it's supposed to be reformed. And it's almost like, you have people who are on one side or the other. Either, we need to abolish the criminal justice system, or we need to go back to mass incarceration and all this other stuff. And so you got the people on the right and the people on the left yelling at each other. And then you've got in the middle, okay, well, what's a smart policy? How do we make this work? And that conversation is kind of getting drowned out in too many instances. So it is difficult to break through that and implement this policy in a sensible way. I mean, police reform to me, it's pretty obvious what we need to do. And look, let me get into the police reform piece of this. This is something I should have gotten into in my opening remarks. So the way to think about police reform that I think really looks at what the experience of our country is, from about, the mid-60s into the early 70s, we developed a very aggressive form of policing. Malcolm Gladwell has written about this, but it was originally what's called the Kansas City style of policing. Kansas City did a thing, mid-70s, where they had a crime problem, and they looked around and they figured out that there was a relatively small portion of their city from which most of the crime was coming. So they said, well, why don't we do this? Why don't we go into that, I don't know, 2-3 square mile block, and let's get aggressive. And what does aggressive mean? Aggressive means you pull people over. You do stop and frisk, pretext stops. You didn't put your turn signal on when you changed lanes, and you're in a suspicious neighborhood. So we're going to pull you over. We're going to get really aggressive about our policing. Okay. Number one piece of it. The second piece is law enforcement, in dealing with that, basically views every single stop as an existential threat. There's this video that every police recruit sees of a police officer getting killed after a traffic stop, the details of which I won't get into. But the message is, when you pull that person over, when you stop that person on the street, your life's on the line, buddy. So you better be prepared. Okay. So you're coming into this situation aggressive and on your guard. And then number 3 is the notion that the only way to protect yourself is to, quote, dominate the encounter, end quote. Okay. Which is basically, to put the person on their heels from the start. All right. Now, the thing about that approach to policing that most of us on the left don't really want to admit, in terms of reducing crime, it did a pretty damn good job. All right. If you look at the sort of mid 70s, into the early 2000s, when it was really implemented, crime went down. All right. But it also really alienated the community. First of all, you got to think of a police officer as, the enemy, not a friend, because if they showed up, they were going to hassle you whether you did anything or not. All right. Didn't really matter. Number 2, as we have seen, it also wound up with a lot of innocent people being hurt, arrested, or in some cases killed. All right. So how can we do this better? And also in all of this, there was no thought to the person you're dealing with, the individual person who had been stopped, and what might be going on with them. All right. What their mental health condition might be. So how should we reform this? First of all, I think we need to have de-escalation practices. Second of all, you need to not always have the police respond to everything, and reduce this sort of hyper-aggressive policing approach in favor of a community policing approach, which some places have tried, and with great success, by the way, to come into the community and work with them, as opposed to coming into the community and treating them like a problem to be subdued. So we need to retrain all of that to get to a better place on police reform. And then that's when you really get into the logic of, if you're dealing with a mental health crisis, you need to have a different response than that response that I just described, because anyone who works in mental health, as they heard me describe the aggressive policing part, will go, my gosh, you are really going to victimize a lot of people in trauma if you take that approach. And that is exactly what we have done. So let's train law enforcement differently, and let's get the mental health professionals out there to be helpful. And then the final piece that developed throughout all of this is the police became largely unaccountable. All right. If they were a team and if one of them did something wrong, then they protected them. And that is not good for public policy. Just like, people like to talk about members of Congress who, do unethical things. But the thing is, a lot of members of Congress wind up going to jail, all right, if they do unethical things. It's happened throughout my career to a whole bunch of different people. We need that accountability measure. So you have to have that entire backdrop to then say, okay, how do we get after the mental health piece of this? How do we really figure this out? Part of the problem with figuring it out is law enforcement and, quote, tough on crime people. Whenever you come in and start talking about mental health, they instantly think of you as being a defund the police person, as being an abolition person. And by the way, sometimes they're right. Okay. Some people are in that camp. If we can get outside of that camp and get into a reform camp, we could be in a better place. Equally, however, the people who just want to lock everyone up and throw away the key are incredibly resistant to these types of changes as well. So that's what you got to fight your way through if you're a member of Congress trying to rationally and reasonably reform the system. So in addition to the challenge, the city of Seattle has made very limited progress All right. It's shocking to me. Okay. Shocking to me that what are we now? 3 years after George Floyd, when a city as progressive as Seattle and King County hasn't gotten to the point where they have any more than 3 mental health professionals working out of the fire department, I don't know, 5 days a week or whatever it is they're doing. And it's because we're all spinning around with all these other issues instead of focusing on, okay, how can we expand this help for people? There's a whole bunch of other issues that go into it that I'm not going to burden you with in the answer to one question at this point, but we're not making those steps because we're trapped in this larger ideological battle instead of let's do a little practical problem solving. We got a lot of people with mental health problems walking around the streets of Seattle, King County. Let's get mental health professionals and social workers out there to begin to help them because it meshes in with the law enforcement thing in a bad way. I know that's a much longer answer than your question implied, but that's really what we're dealing with in terms of trying to address this issue, not just in Congress, but on the state and local level as well.
Well, that's actually what we want at this conference is the long, detailed, nerdy answers that we can't, pick up in the little media tidbits we get. It does sound that your staff is going to help us to put together a meeting with other congressional staffers, with team leaders around the country, and that's super exciting to me. We have a couple of questions. One is, well, let's dig in a little bit on Seattle because you had 2 events. You had a consent decree that just got wrapped up, and then you had 2020. You really got hit hard like we did in Portland. I had a chat with Reverend Harriet Waldron, who was a member of the consent decree process, and I'm sure you know Reverend Waldron in Seattle. And
Yeah.
she was very pessimistic about the outcome of the consent decree. And in police reform all over the country, advocates are trying to be engaged and involved, but it's a grinded out process. It's not years and years of work, it's decades of work. Do you have any words of wisdom for advocates battling in these court cases and battling with these police reform processes to how we can keep going?
Sure. First of all, to understand, and I'm pretty sure the consent decree has not actually been lifted in Seattle. I think it's still hanging around there. I could be wrong about that. They made some modifications to it. And look, I mean, if you want to understand how Seattle got this problem, way back when in the mid 90s, I was a prosecuting attorney for the city of Seattle. Sorry, I wasn't the prosecuting attorney. I was one of the minions there working on it. And look, Seattle, was one of those places like many others that adopted that very aggressive style of policing. And there was a lack of accountability within the police force, and there was, many different abuses. And part of it also is it feeds into racism. The perception is that, the Black community is more likely to have crime. So you go in there and you arrest more of them, and it becomes a self-fulfilling prophecy. Okay. I think of a lot of police officers who, being completely honest, they would say, well, I'm not racist. I just think Black people commit more crime. Okay. Which is racist. All right. And it led to, and it also, it empowers racists. Okay. To not be held accountable. We had a real problem in the city of Seattle with a disproportionate impact where communities of color, and particularly Black communities, were being unfairly targeted. That very legitimately led the consent decree to say, hey, you need to fix this, and you need to get inside of your department and understand the racism and the racist practices that are being employed. But what has happened, and certainly the protests in 2020 didn't help, we have something of a pitched battle going on between law enforcement and the broader political activist community in the Seattle, King County area. And we need law enforcement. We do. And trying to get at any sort of sensible reform here is bogged down by the fact that we have a very entrenched, for the most part, police officers guild in Seattle and a very aggressive activist base coming after them. So, for instance, on our Health One thing, to make this work, you would need politicians and police. Police are going to be part of this working together. They are disinclined to work together at the moment because it's a bit of an overstatement to say that they hate each other, but it's not far off. In fact, one of the problems we're having in Seattle, King County, is we can't hire police officers. We have a hard time hiring people within law enforcement because the perception is you will not be allowed to do your job if you're a police officer in the Seattle, King County area. And that's making it hard to get people come in here and be willing to do that. As far as where the fault lies in all of this, I think there's plenty of fault to go around. Certainly the resistance of the law enforcement community to any sort of accountability. Years before George Floyd, I worked on De-Escalate Washington, which was a statewide initiative to try to change the law so that a police officer who committed a crime, basically, could actually be held accountable. And that was a difficult little fight right there, even to get that tiny little step forward. So we need to try and resolve that. Now, the other part of the problem, I'm going to go ahead and be perfectly honest with the activist community here, is, the whole abolition defund thing. We had a city attorney candidate in the city of Seattle who during the protests had posted many very, very, she said, and I quote, "I hate cops." Okay, and a couple other things that I will not repeat here. Now it was social media posts and whatever, but she got like 47% of the vote. All right. So if you're a police officer working in the city of Seattle, that's what you're looking for. So the aggressive attacks on police and then the over aggressive policing that led to that has sort of put people into two very what's the word I'm looking for? Put them into two camps that don't really want to deal with each other. And we got to deal with each other. We've got to sort of work our way through that. So how do we get to sensible police reform in the midst of that level of animosity? It's difficult. And then, we don't have a terribly effective government in Seattle because we're caught up in a lot of ideological fights. And the idea that you just need to spend money wisely and make intelligence decisions and require efficiency and effectiveness, that's a tough conversation. I mean, to begin with, in the city of Seattle and King County, very few people are back in the office. Okay. We are now 3 years past it. And King County, I mean, I go down there frequently. There's nobody there. Now, I know we're all working from home, but that does not build the type of collaborative relationship, and it does not deliver as effective services as it otherwise went. So part of it is we need to get back to work. We need to get City of Seattle, King County people back in the office, working with each other to find solutions to these problems. So we are still struggling to come out of the pandemic and to come out of the George Floyd thing here and actually work together on addressing these problems. And I know Portland is the same way. My in-laws live in Portland, so I spend a lot of time down there. And yeah, it's a major challenge.
Yeah, it seems that the police reformers really made it very difficult to lift these programs up, which require that nuanced and long and cooperative conversation between 911 and law enforcement, often fire, and other emergency services. Let me ask about advocating on the local level. Some of these solutions are federal, but some of them are state and local. And do you have any advice for advocates and people who are putting these teams together at the local level of how to communicate more effectively with mayors and with police chiefs and with county commissioners?
See, it's actually it's linked. Okay, what we do on the federal level is we can help provide funds for the reforms that are coming about. The best way the system works is when the solutions start at the city and county level, local leaders working together to come up with an idea. And Health One is a great example. Okay, you come up with the Health One idea, you put it together, and then it's like part of your challenge is funds. Okay. Federal government sees something that is working. There are a variety of different grant programs within the criminal justice, within the Department of Justice, that then can drive dollars out to support those programs. And then thanks to Rosa DeLauro, she was the chair of the Appropriations Committee. Now she's the ranking member of the Appropriations Committee. She brought back congressionally directed spending so that individual members of Congress then can drive dollars out to support these programs. And it integrates together. It will always have to start at the local and county level. And again, that just sort of gets me back into my rant about some of the challenges that we have on the local and county level. We have to have a practical problem-solving approach. All right. Where we really try to make it work. But part of it also is you have to believe that we need a functioning criminal justice system. And a lot of people in Seattle, King County don't believe that. They believe that we need to figure out how to make the criminal justice system go away. So when you're coming in and saying, okay, I want funds to reform this. For instance, we have a significant problem with our jails. We have a jail in Seattle that's really old. It's a horrific place. I mean, the systems break down. It's just not good. Okay. In terms of people being able to work there or be incarcerated there. So the logical solution would be to improve it. But if you don't believe in the criminal justice system, then you don't believe that a jail can be improved. So pretty much no funds have gone to doing that. It's just sort of going down. And now, they've reduced the population there significantly, which I know my suburban cities certainly are concerned about because they're dealing with a significant increase in drug abuse, property crimes, physical crimes. And they got no place, to go with the people that they pick up. So you've got to try to make the thing work more effectively on the local level. And then once you then get a system that's working, the federal government can help out with dollars to make that work, to help support some of these services and some of these other programs. For instance, alternatives. And I think alternatives to incarceration are incredibly important. I think it's a much better way in many instances to deal with people who have committed crimes, to figure out what's going on with them, how you can help with them. You can set up a successful alternative program, and then you can fund it. Now, the problem with our alternative programs in King County is there is no accountability. And I'm not exaggerating with what I say here. The alternative programs basically are a decision primarily driven by the prosecutor's office, because prosecutors have complete discretion that they can charge who they want to charge, forgive me, and not charge who they don't want to charge. So instead of sending them through the criminal justice system, what they've done is they've taken individual suspects and they send them to community-based organizations, which is fine. Okay, there's a bunch of different community-based organizations, but there's no accountability here. They send them there, but there's no requirement for what the program is. And if the person who is sent there gets there and says, okay, what am I doing here? Well, here's what you're doing. Well, I don't want to do that. Well, we were like, well, okay, well, if I don't, what are you going to do to me? Nothing. Okay. So like half the people who are sent to alternative programs simply walk away and nothing happens. All right. So there's no accountability within the system to make this work. And I view this, if we're going to generate alternatives to policing and alternatives to the criminal justice system, there has to be accountability and there has to be a logic behind what is being provided to the people who are getting these alternatives. I think it's great. That's where we got to go, but it can't be, we just don't want you to be arrested. So, go and I hope it works out. There has to be some intellectual rigor, some desire to sort of make these programs work. But if you do, then the way the federal government can work and the way the state can work is we can help provide funds for those programs that are working. We're just struggling a little bit to get off the ground on that sort of efficiency and effectiveness in the way we implement these new programs.
And Rep. Smith, just to clarify, by diversion programs, you're referring to a program in King County, Alternatives. Are you meaning a jail diversion program?
Yeah.
Criminal?
Well, no, actually, most of the diversion programs in King County start before that. Originally, when the idea for diversion came up, there was like drug court. And the idea was, okay, you get arrested, you've been charged, you go before the judge, and the judge says, okay, here's what we're going to do. This whole thing goes away if you do this program for 2 years. If you don't do the program for 2 years, then you're back before the court and you will be convicted and you will face the normal system. What most of the new diversion programs in Seattle, King County do is they take the courts completely out of it. You don't go to court. You don't get charged, nothing. All right.
Mm-hmm.
Now, they've told me that they keep records. So basically, if someone gets arrested and come in and goes to a diversion program, they have a record of it. I have yet to find any evidence whatsoever that person ever is brought back and charged with that crime that they committed. It is basically a complete faith in the diversion system with no accountability, no hammer, if you will. Okay. It's up to the individual to decide what treatment they wish to seek or what help they wish to seek.
Oh, that's very different than most drug court programs or most mental health court programs.
Yeah. We have a little bit of both here. Let's be honest. There are still some programs that go through the court system itself. But there just hasn't been and I think this other diversion model could absolutely work if there was a little bit more oversight, discipline, and accountability. And then you get into the question of, okay, what's the program? What are you doing? And most of it, which I think is perfectly appropriate, is focused on what are the needs of the individual in question? Because it's absolutely true that most people who commit crime are struggling with one thing or another. Okay, in our case, substance abuse is a huge part of the problem, as we've seen significant spikes in that. So our drug policy is also another conversation about how we deal with that. But also they may have economic needs, educational needs, so put them into that program. But the other piece of it is, what is the accountability for the crime that was committed? And that's, where we get a little squishy around here in terms of whether or not there ought to be any accountability. So I think these programs can work. I think, with another huge problem with that, jail and policing system that I talked about was the mass incarceration problem. The number of people who were put in prison, who probably didn't need to be there for the safety of the community. And then once in there, what programs were there to rehabilitate them, to put them in a better position when they came out? Nothing. So we made it worse in that regard.
So many problems, and it seems like much of the work of these alternative outreach teams is sort of filling in the gaps between these programs. But these teams also want to be accountable. And there's a question from Morning Fox in Vermont, and they ask, what are some measurements of success you would see for alternative outreach teams?
Well, I think, it's hard to measure that. I think some measurements, gosh, I'd have to think about that. One of the main things you're trying to do is to get people help. So I guess one measurement of success is how many people actually get that help. Do they actually get into a program that helps them with their challenge? And the next measurement of success would be, how much do you reduce for lack of a better way to put it, the frequent flyers in our system? People who show up in the emergency room, 10, 15 times a week, who call 911 frequently with one emergency or another, or have a family member or a friend who's calling it. So and I think every community can identify, here's 100 people who are frequently in the system, either for some petty crime or, drug abuse or just the mental health problem that shows up. Are you able to reduce those numbers overall, number one? And number two, when you look at the specific individuals who have been in that system, how many of them get help and then cease to be regular parts of the system? I think it'd be fairly easy to track these specific individuals who have had high needs of one kind or another and say, do those needs go down? Do reduce the number of them. I think another legitimate measurement of it is, the reduction in people who wind up, being harmed in custody. Let's put it that way. I think those would be some good measurements that we could put in place. And that's an excellent question and something that we need to spend a little more time thinking on than my quick little answer there.
It's a question that preoccupies our team leaders continuously. It seems like each team is sort of developed locally and targeted at its own set of outcomes, right, which lead it to those measurements. But there isn't a real consistency across the country.
Yeah. No, and it's a really difficult sort of thing. And I think that's one of the things, going back to my mental health experience, the biggest thing I wanted to figure out what was wrong with me and how to get better. It took me a while, but I did figure it out. And I think there is more of a broad perception in the community that if you have a mental health problem, well, that's it.
Yeah.
You just got a mental health problem. That's just the way it's going to be. And we're going to have to figure out how to manage it. I very much disagree with that outlook. There are treatments that can work, that can help you back to a healthy and productive life. And I think part of the way we measure it is how many of the people that we encounter do we get back to that healthy, productive life by actually giving them the treatment, figuring out what's going on with them that is causing the mental health problem and fixing it. Now, obviously, there are some much more severe mental health problems than what I dealt with or others dealt with that are hard to get at. But I think there is a larger group, whether you're talking about a mental health issue or a substance abuse issue, that is a fixable problem if we focus on fixing it, if we focus on getting the person, to actually deal with their mental health issue, to actually deal with their substance abuse issue. And let me just put one other brief little advertisement in here. We rely way too much on drugs as a way of treating this. There are some people, without question, who need their medication. You've got severe bipolar situations, schizophrenia, things like that. But I think we very quickly put people on medications of a variety of different kinds that can be more damaging than helpful. And meanwhile, we have a massive substance abuse problem out there. And our solution to it is to tell people that they need to take drugs. There's a little bit of an inconsistency there. And I'll just mention one. I had anxiety. So the drug that they were throwing at me was a benzodiazepine. And benzodiazepines are really effective at dealing with anxiety in the short term. But in the long term,
Some side effects.
Yeah, side effects, but also you don't get at the root cause of the problem. Benzodiazepines just sort of temporarily numb that portion of your brain that is focused on the problem. Problem didn't go away. And as you develop dependency on the drug, you need more and more of it to make that problem go away. So, we need to really get at the core mental health issues and treat people for what they're dealing with. So one big measurement would be, have people move back to being able to lead a healthier and more productive life.
Well, last question for you, and it's maybe a little bit of an ambush, but with big court ruling announced yesterday evening from the Ninth Circuit Court, which affects about probably 50 or 70% of our audiences in the Ninth Circuit on the West Coast, in reference to the Martin versus Boise. And the court has at this moment sounded like they're not going to review the initial issue, and that the opinion of the Department of Justice will stand for now. But it also sounds like Grants Pass is willing to take it to the Supreme Court.
Refresh my memory. I recognize the name, but I don't remember the issue. What was the ruling of the lower court?
The ninth or the lower court. Well, Grants Pass sued to say that they could criminally prosecute people for being homeless.
Right.
And the Ninth Circuit said, no, that's a violation of the Eighth Amendment. And the Ninth Circuit, they appealed, and the Ninth Circuit says, no, we're not going to rehear this.
Yeah.
So but a lot of passion on the part of the dissenters on the Ninth Circuit, and this is still a passionate issue, I know, in Seattle, and certainly here in Portland, San Francisco, Los Angeles, of people that our outreach teams are going out to every day who are in crisis.
Yeah, well, and I think this gets at a different issue, a broader issue, sorry, not different. Whether or not you can criminally prosecute them, can you compel people to seek treatment or to live in certain places that they don't want to live in? New York City, actually, I was just reading in the Times yesterday that, they instituted this program that said, even if you cannot prove that a person is a danger to themselves or others, you can handcuff them, pick them up, and force them into a treatment facility. All right. And I got to tell you, I err on the side of we need to be willing to push people towards treatment, to push people toward whether it's mental health or substance abuse. The sort of popular opinion, and I'm sure like 95% of the people on this thing will disagree with me on this, is no, the individual has to make that decision. Okay. And I just think you have to be able to do something to encourage and push people to make a different decision. Because we've seen such a massive increase in drug use in certainly Seattle, King County, and elsewhere, which corresponds right along the time that we decriminalized it. I mean, they decriminalized it in Oregon. They effectively decriminalized it in the state of Washington. There's no, what hammer do you have to tell someone, you can't, hang out in downtown Seattle and smoke fentanyl all day? But I mean, if they want to do that, they can do that. And if our opinion is, well, then we have to just sort of make them safe and protect them and everything else, and never say, yeah, we're not going to let you do that anymore. We're going to take some affirmative steps here. I think that's a problem. I think you expand the number of people who are doing these drugs, and then those drugs frequently lead to mental health issues. It goes both ways. Certainly you have mental health issues, and as I alluded to earlier, you turn to drugs as sort of the solution, but drugs can also develop mental health problems. So I think we need to come up with some sort of plan to reduce that level of drug use. Now, and the other, on the homelessness piece, it's like, can you require someone to go into a shelter that they don't want to go into for one reason or another? Mm-hmm. I think you kind of should in some instances. I don't think it's a black and white issue one way or the other. But it's certainly something that we've wrestled with, and in many Ninth Circuit jurisdictions, as a matter of fact.
Yeah, that gray is where that place between the black and the white is where these outreach teams seem to live. And
that's why they're so important.
Being at the window of opportunity to intervene is very small, and you got to be present. Someone's got to be present to say, I will navigate you. I will help you at that moment.
Yeah. No, look, this is the definitive challenge certainly in my district. And my district is Seattle down into South King County. I always say it's a combination of 5 issues. It's, criminal justice system, it's homelessness, it's substance abuse, and mental health issues, and then, job training and workforce development so that people have some option. I'm sorry, affordable housing. Affordable housing is the big one. Those issues have created a situation where we have a lot of people who are economically insecure. We have a lot of people facing substance abuse problems and homelessness, and there's a lot of crime. So we got to figure out how to work with our communities to improve that.
Unfortunately, when the opportunity arises, so often, and we'll have to be wrapping up pretty quick. So often there is no place for folks to go which is both effective and suitable for their needs from their perspective. Yeah. And this is where the lived experience is important as a way of shaping these programs. Any ideas about how we can create treatment, or how the federal government can help fund treatment systems that are more effective or more suitable for folks coming out of homelessness?
Well, like I said, we can fund whatever the local and county generate, but I gotta just sort of foot stomp a point here that the lived experience is part of it, but there also has to be expectations and accountability. And I think the expectation ought to be that, you're going to find a way to provide for yourself. You're not going to abuse drugs, and you're not going to commit crime. We're going to help you get there. Okay. I'm not one of these conservatives who's like, you're going to do these things, and if you don't, we're going to throw you in jail until you figure it out. No, I don't agree with that. But nor do I agree with the thing like, well, if these are your life choices, then we're just going to have to sort of help you be able to exist with those life choices. And it is completely wrong for us to do anything that sort of sounds like judgment. All right. No, we're just, if that's the way you want to be, you let us know when it is that you want help, and then it's up to us to be there to provide it. But in the meantime, there's no way we can tell you that you're making a bad choice. I just don't think that works. We've got to set expectations. We got to help people get to a better, more productive place. Not just sort of sit back and let them make whatever choice they want to make. And it's going to differ, as you know, case by case. Individuals respond to different things. I certainly know that in my experience. But the goal has to be to help people to get off drugs and get off the streets, and to build sort of a community where they can do that. And we need to be better at it than we are right now.
one of the most valuable resources for these outreach teams to be able to offer people to get off the streets is of course housing, as you say, but also immediate access to effective drug treatment, detoxification services, and mental health treatment. Here in Portland, it's about an 8-week wait to get an intake appointment at this point for if you're a homeless person. Yeah. And that's a real challenge to get someone willing to wait and willing to participate in that conversation. Any thoughts about how the federal government can help to reduce these wait times?
Yeah, I got to look a little bit more into the specifics of the wait time. Look, at the end of the day, like I said, what the federal government can do is the local and state, local, county, state, they set up an effective program, and we help provide some funds to support the funds that they provide so that that program can serve more people. I do know that in the state of Oregon, when they did the decriminalization program, one of the ideas was to set up support services. And, the study that I saw said that like 1% of the people offered the services accepted them. So it's both a problem of how do you get people willing to seek treatment, and then how do you make sure the treatment is there? I think both of those things need to be put in place. And what I'm trying to do on the federal government level is for those communities who set these things up, can we provide funds so that they can expand the number of people that they can treat and serve?
One of the resource of housing, we now have this new model of permanent supportive housing, and I'm sure there's a lot of this being developed in the King County, Seattle area. Could you speak about the success of permanent supportive housing and how that's really something that's come from the federal government, sort of a mandate to create?
Well, I think and the basic idea is you get people into housing, but you also make sure that they have basic support services. And those basic support services are, in many cases, mental health treatment, perhaps, drug abuse treatment, but then also, how do you, find a job? How do we get you job training, education that you need to meet your needs, so that those services are provided in addition to the housing, because you've got to do that. When one of the things that the Regional Homeless Authority did, I think it was during the pandemic, they bought a bunch of hotels and they put people in there with no supervision, no rules, and no services. It was an utter disaster. Okay. You had people, you had fires being started, you had people dying of overdoses, you had, crime in the community. No, I mean, you can't just provide housing. You also have to be able to provide services and some structure to those communities.
Well, Congressman Adam,
that's the idea behind permanent supportive housing.
Well, Congressman Adam Smith, thank you so much for visiting with us at the Law and Mental Health Conference. This has been very interesting and much to follow up on. Yeah, absolutely. And like I said, the issues that you're talking about, probably the most important issues, certainly for my district, and I think for many communities across the country. So I appreciate your leadership. Great. Take care. You too. Thank you very much.